All right, welcome everybody. I hope everybody enjoyed a couple-minute break there. I'm really excited for this next session. It's called Prevention. It's everybody's business, and it's being led by the Executive Director of Chenango Health Network, Kimberly Lorraine. And Chenango Health Network and Drug Free Chenango are our presenting sponsors for today. I'm very thankful for their participation and their support of yet again the second Workforce Summit. Very happy to have them here, and this is such a great topic. We're going to get right into it. I just want to give you a little background information about our speaker. Kim Lorraine is the Executive Director of Chenango Health Network. She has 30 years experience in various health and human service organizations. She earned her bachelor's degree in business administration from SUNY Poly in Utica, and her husband, Steve Lorraine, is the Madison County Soil and Water Conservation District. She has raised 3 children in Hamilton, where they live. Kim is proud to serve Chenango County and the amazing staff and board of Chenango Health Network. And I'm very proud to say that I'm on the board of Chenango Health Network. It's, they do amazing things, and you think you understand what they do, and then you get on the board and you realize how much they actually do. And I'm still learning. I'm still a fairly new board member, but I'm very happy to support Chenango Health Network and thankful that they're participating. So I will turn it over to Kim.
Oh, thank you, Carrie. That was a lovely introduction. I appreciate it. So for those of you that don't know, Chenango Health Network, we partner with other health and human service organizations to identify community needs and look for ways to address those needs. Rural health networks are given a block of money from New York State, and then it's our job to kind of work with the community and figure out where the gaps are in healthcare, health information, social determinants of health, and try to help others and ourselves make that happen together. Chenango Health Network's board of directors are healthcare leaders in Chenango County that are committed to maintaining a health network and providing meaningful service to the community. Our staff members are dedicated to carrying out our services with integrity and respect. There is no wrong door at Chenango Health Network. If you find your way to us, and you're looking for the needle exchange program, someone will walk you down to step to access the needle exchange program. If you're looking for housing services and you happen to find your way to us, someone will invite you in and help make that phone call and get you an appointment with Department of Social Services or HUD. There really is no wrong door. If our staff don't have the resources to help with something, we often know who will, and we can help make that connection. Our offices are in the Eaton Center. We are on the 2nd floor, and you go in through Conkey Ave. We are still operating on a hybrid model. COVID taught me anyway, that our staff can do their work from anywhere, and them having flexibility makes their quality of work so much better. The best way to get a hold of somebody if you're looking for services from us is to call and leave a message, and I promise you someone will call back. Our forward-facing workers check their email and check their phone messages every 1 to 2 hours and make calls throughout the day. I do not need to tell you about myself because Carrie already did. I will say that I believe a good workforce is a healthy workforce, and that includes being physically healthy, emotionally healthy, financially healthy, and socially healthy. Chenango Health Network has some programs that could help you or could help your employees to just have one less thing to worry about or add an additional tool to your toolbox to help you stay healthy. And I'm going to tell you about some of those. These are our programs: Cancer Support Group, Financial Assistance for Cancer Patients, Prescription Assistance, Community Health Advocates, Health Insurance Assistance, Substance Use Disorder Community Health Worker, Tobacco Free Chenango, Chenango Substance Abuse Prevention Coalition, and community-based education services. So I will tell you a little bit about our Cancer Support Group. Even though a lot of people receive support from family and friends, the #1 reason that they join a support group is to be with others who have similar cancer experiences. Some research shows that joining a support group improves both quality of life and survival. Support groups can help folks feel better, more hopeful, and not so alone. give them a chance to talk about their feelings and work through them, help them deal with practical problems, such as problems at work or school, and help people cope with the side effects of treatment by sharing with others that have been through it. So Chenango Health Network's Cancer Support Group meets on the last Monday of each month, currently at the YMCA. And we're very lucky that Jamie has allowed us to use that space. There are usually between 6 and 12 people that attend the meeting, but we are open for more. We have plenty of space. We try to provide dinner at each meeting, and we're lucky, really lucky, to have local restaurants that are willing to help out with that. We do ask that people call our office. Sandy Myers is the woman who's in charge of the support group. Call our office and just let her know that you are interested in coming to the support group, just so that we know that we have enough food for everybody. Another program that we have that is extremely helpful to folks is our financial assistance program for cancer patients. We help anyone with a cancer diagnosis. We're generously funded by a foundation called St. Agatha's to help folks that have a breast cancer diagnosis. That program is based on income, and it does have to be a breast cancer diagnosis. You do have to live in Chenango County, but we can provide up to $5,000 in assistance for things that health insurance doesn't cover. Gas to get to specialty appointments, and any other treatments that aren't covered. We can also, in some cases, help out with up to 3 months of living assistance. So if your cancer diagnosis or your treatment makes it so that you can't work and you can't pay your rent, or you can't make your car payment or your cell phone payment, for the breast cancer assistance for low-income individuals through St. Agatha's, we can help with those kinds of things as well. St. Agatha is very well funded, and we always have room for more folks. And I like stories about people that we helped. I think that goes a long way to help people understand and get an idea of who we help. One of the clients that we were able to help with St. Agatha's funding was taken out of work due to her diagnosis and her treatment plan. We were able to cover 3 months of her rent, as well as some of her medical bills that were not covered by insurance, and get her gas cards to cover the cost of traveling to and from her appointments in Syracuse. She is now done with both chemotherapy and radiation and is going back to work this month in May. We also have funds that are donated, and while there's no income restrictions for donated cancer support funds, that means anybody can apply for that, and we're not going to ask you for your income to be a determining factor as to whether or not we can help you. Those funds are more limited, and there's a $500 cap on the amount of assistance available to each person. We've helped men, women, and children. And I'm going to try to say this one without crying, but the youngest person that Sandy was able to help was only 3 years old when she was diagnosed. And the only assistance that the family really needed was gas cards to get to treatment, just to make the other expenses in their lives a little bit more manageable. She just recently reached her $500 limit, and she is 5. We do take donations for cancer support, and I just want to give a shout out to one local business that's led the way in supporting this mission. Sandy Myers, who runs our cancer support program, said that she has had the pleasure of working with Rosebud Tattoo and Tanning for 4 years. The owner's 4 young daughters wanted to do something to help people in the community, so once a year, the girls set up a shop and offer temporary tattoos. The girls charge $1 for each temporary tattoo, and they also sell lemonade and baked goods at the event. Over the years, these 4 little girls have raised close to $6,000 to help Chenango Health Network help people in Chenango County that are struggling with a cancer diagnosis. Another program that we have is prescription assistance. Chenango Health Network provides long-term prescription assistance to Chenango County residents by helping them through the process of applying for pharmaceutical manufacturer patient assistant programs, or PAPs. Many pharmaceutical companies offer free medication to low-income and uninsured or underinsured patients. This can often be a confusing and frustrating process, which is where we come in. A recent client contacted us after becoming eligible for Medicare and finding out that he would have a really high copay for one of his name brand prescriptions. We found with a little bit of research that there was a pharmaceutical assistance program for this drug, but it required that he spend $600 out of pocket on the prescription before he would be eligible. Because he had a $500 deductible on his Part D plan, he was able to qualify after just 2 months. He will now get his medication sent to him directly from the manufacturer for the rest of the year, saving him a little over $500 in copays. Chenango Health Network also helps Chenango County residents with one-time prescription assistance. We are very lucky to be generously funded through Chenango United Way for this program. So if someone finds themselves with an unexpected prescription that they just cannot work into their budget, we can provide financial assistance of up to $400. Again, there's no income restriction for the one-time assistance. And that prescription assistance, as long as it's a prescribed item, can also cover medical equipment not prescribed by insurance, such as crutches, wrist and ankle braces, those kinds of things. So if you have employees that, you're lucky enough to find out that there is an issue, this can help. Another program that we have a lot of programs. Another program that we have is called CHA. This one is super cool. New York State, they're all cool, but this one I really like. New York State designated community health advocates are the state's healthcare consumer assistance program. Since 2010, CHA has helped over 350,000 consumers and small businesses obtain healthcare services, understand their health insurance, and make it work for them. Chenango Health Network, we're the only ones that house the CHA, the New York State CHA for Chenango County. And again, it's Sandy Myers and Carrie Wright, who's also an insurance navigator. They are both considered CHAs. Some of the things, and there's no income restriction, and they can help with any kind of insurance that you have. But anyone who needs help understanding how to use their health insurance, if you need help resolving a medical bill or a health debt issue, you can call them. Disputes over coverage denials or eligibility determinations, they can help through that. They can help people get the most from their coverage, like getting prior authorizations, access to specialists, out-of-network services when needed. And they can also help access affordable healthcare services and hospital and prescription financial assistance programs. It's an incredibly cool program. On one occasion, the CHA had a client with a hospital bill, which this amazed me, for $212,000. And someone sent them here after coming in and making an appointment with Sandy. They called the billing office, and it was determined that the no-fault insurance for the vehicle that he was a passenger in had not been billed yet. And neither was the Medicaid bill that he had obtained while being an inpatient at the hospital. After some phone calls and some conversations, he walked out of our office owing nothing, which is $212,000. I mean, I can't even imagine the stress of thinking that you owe $212,000. Another time, a client was billed because the facility that they were accessing didn't participate in their particular insurance. The client wasn't aware of this, and the person making the appointment, for whatever reason, bypassed the pop-up that comes up on the computer stating that the insurance was not one that they participated in. The community health advocate helped them complete a financial assistance form with the facility, and it was denied because the client had insurance. The CHA then helps the client apply for an appeal, and that they won because it was not explained to the client that that facility did not accept their insurance. Sometimes somebody calls and needs help, and Sandy and Carrie can work through it in 1 or 2 phone calls and a few questions answered. Sometimes it's several meetings and phone calls. They have access to folks at Legal Aid, and there is a whole network through New York State of CHAs that they meet with every month and get trainings and updates, and they have access to those people if they run into something that they can't help with. So my suggestion is, if you have somebody that you know that they're struggling with a medical billing issue or denial issue, have them give a call. And like I said, if Sandy or Carrie can't help them, they may know where to send them that they can. And again, there's no income requirements. Another program that we have is an insurance navigator. Chenango Health Network's Navigator program has assisted thousands of community members enroll in affordable healthcare coverage over the past 8 years. Over those 8 years, we've seen many scenarios in which consumers have reached out for our assistance, some of which include losing a job, retiring, getting married or divorced, having a baby, being released from incarceration, or moving to the area. Recently, an individual who had retired early in order to provide childcare for her granddaughter contacted our office. She had always carried health insurance through her employer for her and her husband, who is self-employed, and was now at a loss of how they were going to find affordable coverage. A friend of hers suggested that she contact Chenango Health Network to see if we might be able to help. After running her New York State health marketplace application, we found that the couple was eligible for coverage at no cost. She was extremely relieved. This burden was lifted and she would now be able to care for her grandchild stress-free. This is just one example of many favorable encounters over the past 8 years. While each person's situation is different, the majority of folks that our navigator sees are able to find quality, affordable coverage with the assistance of the health insurance navigator. One of our newer programs, which I also really like, is our community health worker. And our community health worker program is funded through our Rural Community Opioid Resource Program. And we have a very small subcontract through REACH of Ithaca. And our program specializes in supporting people and families at risk of or currently living with substance use disorder, including opioid use disorder. Our program is person-centered, trauma-informed, and harm reduction focused so that we can provide the best supports possible while meeting our people where they are at. Our program utilizes community collaboration between other community agencies that include but are not limited to medication-assisted treatment providers, mental health providers, drug and alcohol treatment providers, primary care providers, recovery providers, housing specialists, in and outpatient treatment providers, law enforcement, Department of Social Services, peer advocates, judicial system representatives, and many more. By our community health worker establishing relationships with all of these different entities ahead of time, it just makes it that much easier for people who already have an awful lot on their plate to find and get the services that they need. One example of a positive outcome with our community collaboration, somebody came into our office to work with Tiffany, is her name, you'll see her information there, to work with Tiffany. And they expressed their needs and barriers that they were facing. And the community health worker took all the information and collaborated with a housing specialist, the judicial system, and drug and alcohol treatment provider. And thus the client has chosen to remain abstinent from use. They're undergoing mental health treatment and medicated assisted treatment. They've maintained an apartment and full-time employment for over 6 months. The client is also receiving and continues to receive support from our community health worker and a peer advocate, and will be graduating drug treatment court in less than a month. The community health worker takes what can be an incredibly overwhelming situation and helps her clients break it down into manageable bites, and she provides a safe and supported connection to those services with no stigma. I'm very proud of that program. So those are all of our outward facing programs. That's how our staff can help community members. We also have a couple of programs that allow community members to help us help the community. One of them is Tobacco Free Chenango. And Tobacco Free Chenango is part of the tobacco free zone of Cortland, Tompkins, and Chenango counties. We work to foster environments supportive of policies that reinforce the tobacco free norm in our communities. Through community engagement and youth action, we promote local changes that reduce the impact of tobacco and nicotine addiction, including reduce the impact of retail tobacco marketing on youth, especially disproportionately affected populations. They work to increase the availability of tobacco-free outdoor shared environments. They work to increase the availability of smoke-free multi-unit housing. and they work to reduce tobacco imagery in youth-related movies. Part of this is a youth group called Reality Check, and that's a youth-led movement in New York State that empowers youth to become leaders in their communities in exposing what they see as manipulative and deceptive marketing tactics of the tobacco industry. The organization's members produce change in their communities through grassroots mobilization and education. Our tobacco-free coordinator is named Brad Morrison, and any local business can contact Brad to learn more about how they can help make not smoking the norm in our community. If you have outdoor space with your business, he can help with some pretty nice signage for outdoor space. And he can also help if you're looking to get more information on smoke-free policies and what that might mean for your business, and the pros and cons to having certain smoke-free policies in your business. You can just give Brad a call. Or shoot him an email. He is wonderful to work with. Last, but certainly not least, and this is where I'm going to put out a plug to everybody in the business community. We received a grant back in October of 2019 to support the Chenango Substance Abuse Prevention Coalition. And in order to do that, we have to have 12 sectors that are engaged in this coalition. And currently, believe it or not, our business sector is vacant. So I'll tell you a little bit about this, and then I will remind you again that our business sector is vacant, and we are looking for somebody that would like to give back to the community. So the Drug-Free Communities Support Program is the nation's leading effort to mobilize communities to prevent and reduce substance use among youth. The DFC program provides grants to community coalitions to strengthen the infrastructure among local partners and to create and sustain a reduction in local youth substance abuse. Say that 3 times fast. So like I said, in October of 2019, we got the grant, 5-year grant to help support the CSAPC, Chenango Substance Abuse Prevention Coalition. The name is currently in the works of being changed to Drug Free Chenango, and we are working with the gentleman, Matt White, who is local, to come up with a new logo for us. So the Chenango Coalition's mission is to reduce youth substance use and promote a safe and healthy environment for Chenango County youth to survive. So I'll tell you a little bit about the coalition. Anyone can join the coalition. We have a general membership meetings 4 times a year in March, June, September, and December on the 3rd Thursday of the month at 8:30 a.m. And our meetings are currently held via Zoom. They used to be in person before the pandemic. The nice thing about them being in Zoom, via Zoom, is that we had some people that were, a good hour away, and now they can come without it taking up 3 to 4 hours of the day. Like I said, one of the requirements from being funded by Drug-Free Communities is that all 12 sectors are represented on the coalition. The sectors include healthcare, state and local government, substance use reduction agency, civic or volunteer organizations, youth serving organizations, law enforcement, religious and fraternal organizations, schools, media, business, parent, and youth. Our business representative is currently open. And this is a great way. I was thinking about this when the keynote speaker was talking this morning. This is a great way if you have somebody that is moving from entry level up into management that wants to take on a leadership role in the community. This is a really good way for them to do that. We are currently interviewing for the position of Drug-Free Communities Coordinator. So if you have any questions about DFC, the coalition, how you can get involved, I am currently the person that you would call. I'm happy to take questions. I guess in closing, I would just like to say that I hope you'll consider letting us help you help your employees who may be facing, heaven forbid, a cancer diagnosis, financial struggles to afford treatments, dealing with an insurance issue or high cost of medications, or let us help them if they're suffering with or supporting someone who's suffering with substance use disorder. We really are a low barrier, no stigma organization. It is not our place to judge, it's our place to offer services and help. I also hope that as leaders in Chenango County, you'll reach out to Chenango Health Network to see how you guys can help make Chenango Health Network a really safe environment for our kiddos. That is all I have, but I will stop sharing. And then I would love to take any questions that you guys might have or have a conversation.
Just got a few minutes left before the next session. Thank you, Kim. Like I said, I know that just scratches the surface of all the things that you and your staff does, and we're very happy to support that. Any questions or comments for Kim before we break for our next breakout session? All right, well, we'll make sure that you have her contact information if there's something you'd like to reach out to her about after. Thank you so much for doing today's session, and thank you again for your sponsorship of today's event. We'll go ahead and break now. The next set of sessions is breakout session number 2. Track A is Equity Eats, which is with Hilda Jordan again, who is our opening speaker. And then session B is how to create a positive work culture, and that is being put on by our friends at New York Central Mutual. So thank you very much, and we'll gather together as a group again at 1 o'clock. Thank you so much.
Thanks, Gary.